what are the 4 most common reasons for shoulder pain? So let's first start with young and active people. If you are young, active, you play badminton or lawn tennis, or you go regularly to gym, then the most common reasons for your shoulder pain could be because of impingement syndrome or bursitis. That simply means that there is a subacromial bursa named thing here in the shoulder joint. Sometimes that bag gets swollen, and that can cause pain while moving the shoulder joint. Also, sometimes there is an impingement. That means a layer within the joints of the shoulder capsule or the shoulder joint, that layer starts getting pressed, and that can also cause pain. Similarly, the third reason could be if there is any muscle tear, like supraspinatus muscle tear or rotator cuff muscle tear. This mostly happens in active individuals, and this causes severe restriction of the movement of shoulder joint. Sometimes when there is trauma, then there could be shoulder dislocation. If there are cases of recurrent shoulder dislocation, then that can cause permanent damage to the shoulder, and this can cause a lot of pain. Also, sometimes the muscles around the shoulder joint, they get swollen, or there is inflammation in the muscles, like in case of biceps muscle, especially in those who are working out in the gym and doing biceps exercises a lot, or with the wrong technique, then this can cause pain. Now, the second reason for the shoulder pain could be because of frozen shoulder. This is normally seen after the age of 45, and this is more common in diabetics. The person normally complains of night pain near the outer part of the shoulder, and there is restriction of the shoulder movement, like the person is not able to take the hand up or take the hand back like this. So if this is the situation, see your doctor, get your MRI done, and whatever be your stage, then your doctor will suggest you treatment accordingly. Third most common reason for shoulder pain is seen in elderly age group, when we have arthritis around the shoulder joint. Now, this could be in a joint known as the AC joint, acromioclavicular joint, which basically comes here at the tip of the shoulder. Or it could be arthritis of the shoulder joint proper, which is known as the glenohumeral joint. Now, if there is arthritis in the glenohumeral joint, then the movement of the shoulder becomes very painful. Sometimes there are attacks of rheumatoid arthritis also. Like rheumatoid arthritis can affect any joint in the body, but if the shoulder gets involved, then also that can cause severe arthritis of the shoulder joint. Also, sometimes there is infection of the shoulder that can lead to septic arthritis. In that case, there is severe pain in the shoulder. Person can develop fever, and he is unable to move the arm because of the severe pain. Except for these 3 reasons, the 4th most common reason for shoulder pain is if there is any fracture or trauma. Supposing if there is any road traffic accident and there is injury to the collarbone, then this collarbone fracture can also cause pain. Similarly, if there is any fracture or injury to the humerus bone, that can also cause pain. And the 3rd most common bone in shoulder that can get injured is the scapula, which is here at the back of the shoulder. So these are the 4 most common reasons for shoulder pain. First happens in young and active individuals. Second is mostly seen in elderly age group. Third is frozen shoulder. And the 4th is because of any injury or trauma. So if you are suffering from shoulder pain, you should consult your doctor, who will get your X-ray or MRI done, and based on your symptoms and your history, he will treat you accordingly. Thank you.